I'm Matt Willis, Public Health Officer for Marin County with an update for November 18th. Today I'm going to talk about winter viruses again because the situation is changing rapidly and there are steps we can all take. Over the past few weeks, we've seen a rapid shift in our data, and I've had many conversations with other healthcare providers about what they're experiencing. I'd like to share with you what we're seeing in Marin. The first is that the number of people coming into local emergency departments with respiratory symptoms is more than twice what it normally is for mid-November. The three main contributors to this surge are in fact the three we were most worried about. RSV, influenza, and COVID are all increasing. Right now, the biggest concern is RSV and its impact on our children and babies. RSV levels in wastewater have doubled since the start of the month. Pediatric hospital beds are hard to find because wards are full. One reason for the concern is that there's not a lot of reserve in the pediatric hospital system generally. In most counties, less than 5% of beds are for kids because kids don't need hospital care very often. In Marin, we have 9 total pediatric beds, and we rely on regional bed capacity. So one problem when we have a lot of sick kids at once is that there aren't a lot of pediatric beds to begin with across the region. The number of nurses and doctors who can provide inpatient pediatric care is limited. Because we're rapidly exceeding the usual bed demand, this week the state of California activated special pediatric surge protocols. These allow certain measures to be taken to increase capacity. For example, staff ratios can be relaxed to allow a nurse to care for more kids. Older kids can be managed on normal adult wards, and transfer processes have changed to allow sick kids to find beds across the state, often far from home. Every day now, Marin hospitals are getting requests to accept transfers from across California. None of these surge measures are steps anyone would want to have to take, but are necessary to ensure kids who have the highest need of levels of care have access to it. So far in Marin, our children who need beds are finding them, but it's an increasing challenge. So while RSV is the current greatest concern, what's changed most in the past week is influenza rates in adults. Since my last update, there has been a 23-fold increase in the amount of influenza virus found in our wastewater. Because wastewater often precedes what we see clinically, I'm concerned we could be facing a large surge in adults' cases of flu that would compound the RSV surge. Some hospitals in other parts of the state have already put tents in parking lots to keep up with the surge in viral illness. This is where I see how the connection between our healthcare system, public health, and our actions in the community are inseparable. It's especially important now for all of us to do our part to stem the tide of serious illness. A system that gets backed up with preventable viral illness can cause dangerous delays in care for any serious conditions. I'm not saying that our hospitals in Marin are overwhelmed, and our community should rest assured that they can receive the care they need. But in order to protect that resource, we all have a part to play. It's time for us to do the simple things we know work to prevent us from becoming infected and from becoming seriously ill. And if you pick one thing, it's to get vaccinated with the updated booster and the flu shot. For preventing RSV, it's mainly washing your hands frequently, especially if you're handling infants and babies, coughing and sneezing into your elbow, and staying home when you're sick. Of course, wearing a good mask is still a great way to protect yourself and others from all respiratory viruses. And finally, if you do have symptoms, rather than traveling to a clinic or to the emergency department, reach out by phone or virtually to your healthcare provider first. You can get great support and care over the phone or video. I know these prevention messages aren't new, but what has changed is the level of importance, with a renewed sense of urgency, seeing what's at stake on the impact on our healthcare system. And it's still just November. Still, my family's excited to get together soon, and none of that has changed, and I hope yours is too. But we'll be doubling down to protect one another, knowing our health is the most important gift we have. Thank you for doing your part.